How to regulate emotion in PTSD recovery. Post-traumatic stress disorder develops after a person endures a frightening, scary, or life-threatening situation. While people without PTSD may feel afraid in situations where there is a clear source of danger, known as the fight or flight response, PTSD sufferers may feel frightened in seemingly ordinary situations. Being able to identify, understand, and manage your feelings through emotional regulation is helpful to recover from PTSD. Method 1: Developing emotional awareness. 1. Identify emotional triggers. An important aspect of managing your emotions with PTSD is learning how to recognize triggers that impact you emotionally. If you have awareness of what kind of people, places, or things upset your emotions, you are better equipped to develop skills to avoid or prepare for these triggers. A trigger is basically anything that brings up memories of the traumatic event you experienced. It can be something internal like a thought or something external like going to a certain place. When you face this trigger, you are more likely to experience the symptoms of PTSD, such as flashbacks, a heightened startle reaction, or extreme anxiety. For example, if you develop PTSD after being mugged in a dark alley, a trigger for you may be walking into an alley, walking alone at night, or even going anywhere near where the mugging occurred. 2. Label your emotions. Another significant step towards developing emotional awareness is learning how to connect the emotions you feel to their accompanying physiological responses, thoughts, or behaviors. You may have difficulty explaining or identifying certain emotions. However, when you can observe other cues happening in your body and in your mind, you can figure out which emotion you are experiencing. Think about what happened right before. Sometimes, the stimulus of your emotional reaction can help you label an emotion. For instance, if someone insulted you in front of a group, your reaction may be anger or humiliation. Consider your physical state. Emotions also cause physiological sensations. When you are sad, you may feel like there's a hole in your chest or that your shoulders are really heavy. When you are afraid, your heart might beat really fast. When you are happy, you may feel light on your feet. Humiliation may translate to a redness or hotness in your ears. Reflect on your actions. Emotions prompt you to act. The action that you want to take can provide clues as to what you're feeling. For example, if you are humiliated, you may want to go hide behind something or disappear. If you are angry, you may want to kick something or hit someone. Notice your thoughts. What you're thinking also helps you label an emotion. If you are thinking "I'm all alone," you may feel sad or rejected. If you are thinking "I wish I could hit him," you are probably angry. 3. Stop judging your feelings. Criticizing or judging your emotional state hinders your emotional awareness because it prompts you to suppress or ignore your feelings. In fact, avoidance of thoughts or feelings relating to the trauma is one of the main symptoms of PTSD. Feeling negative or painful emotions can be upsetting and hard. But doing this is an important part of your recovery. Challenge yourself to sit with your emotions without judging or criticizing. Do this by describing what you are feeling. You might say, "I feel humiliated because my boss called me out at work. My face is really hot and I don't want to go to work tomorrow." 4. Validate what you're feeling. Instead of judging your emotions, which can cause even more pain, show compassion to yourself through validation. Continuing with the aforementioned example, you could tell yourself, "Feeling humiliated is uncomfortable. I don't like feeling this way." Problem: solve the issue. If you can, think of a way to take action that empowers you to focus on a solution rather than the problem. For example, you might say, "Humiliation sucks, but it's not the end of the world. How can I make myself feel better?" I think I will treat myself to a nice dinner to lift my mood. Method 2: Coping with upsetting emotions. 1. Stimulate the relaxation response with calm, deep breathing. Anxiety is a hallmark symptom associated with PTSD, and deep breathing is one of the most effective ways to reduce anxiety in the moment. When you feel afraid or worried, your body enters the fight or flight mode. Deep breathing allows you to control the rate of oxygen entering your body, causing you to feel more relaxed. Close your eyes. However, if you are having flashbacks or dissociation, e.g. an out-of-body experience, it may be best to keep your eyes open. Breathe in slowly through your nose for about 4 seconds, feeling the air, cause your lower belly, to expand. Hold the breath briefly for a second or 2. Then, exhale by releasing the breath from your mouth for 4 counts. Wait a few seconds, and then repeat the process to achieve a more relaxed state. This will stimulate the phrenic nerve and help to relax you by activating the parasympathetic nervous system. 2. Practice mindfulness. Regulating the painful emotions of your PTSD requires stocking a toolbox with skills that help you to cope with those emotions. When you get caught up in your thoughts and feelings, it can be helpful to back away from regret about the past or fear about the future. Mindfulness is a method that allows you to maintain focus on the here and now. Directing your attention on the present moment can help you gain control of negative feelings. To practice mindful breathing, find a quiet place where you can sit without any interruptions. Choose a sofa or floor cushion. Close your eyes or focus on a simple point like the wall ahead of you. Breathe in deeply. Keep track of your count in your head. With each inhale and exhale, simple think 1. If you notice your thoughts wandering, go back to focusing on your breath and restart the count at 1. Don't judge yourself when your attention wanders, simply return to your deep breathing. Practicing mindfulness helps you become aware of your feelings and how they make your body react. You become more in touch with your feelings and how to deal with them as a result of this method of therapy. 3. Try grounding techniques. Establish safety and reconnect with yourself and your environment by using a grounding technique. You may have to try a range of different methods to determine which works best for helping you gain control of your emotions and return to the present moment. Grounding helps you reconnect with the here and now when your thoughts or feelings take you to a painful place. You can wash your face with cool water. Rub your hands over the wall or carpet if you are dissociating. Grab an item that helps you feel calm, like a shirt that smells like your partner's scent or eating candy that reminds you of childhood or a happier time. Or, you can listen to a soothing song. Carrying a grounding object like a stone or something that has personal meaning may comfort you and bring you back into touch with the moment. 4. Move your body. Aerobic and strength training exercises can make you feel better as you learn to cope with PTSD. Physical activity generates feel-good chemicals in your body that lift your mood and give you a burst of energy. What's more, engaging in vigorous exercise can distract your thoughts when you find yourself ruminating over the traumatic event that you experienced. Do something that you think you will commit to and do it often. Try cycling, hiking, running, dancing, or even walking your dog around the block. According to the President's Council on Fitness, Sports, and Nutrition, you need to exercise for 150 minutes every week. This is approximately 30 minutes 5 times a week. 5. Take care of yourself. Using relaxation techniques like deep breathing and mindfulness may help you fight stress, but it's important to have an arsenal of strategies to help you better regulate your mood. Excessive worries or fear can lead to you making unhealthy lifestyle choices. To help yourself cope after a trauma, consume a nutrient-rich diet, get 7 to 9 hours of rest each night, avoid alcohol and drugs, and perform regular self-care. Self-care activities may include reaching out to others for social connection, exercising, reading a book, watching a funny movie, taking a hot bath, or going for a walk in nature. Try to incorporate a few activities into your daily regimen to fight stress and support both your physical and mental health. Method 3: Empowering your thoughts. 1. Overcome negative self-talk. When you encounter triggers with PTSD, your emotional state can become negative very quickly. Identify negative thought patterns and challenge these thoughts to improve your mood. Common forms of negative self-talk include filtering, e.g., only focusing on the bad, personalizing, e.g., blaming yourself for negative outcomes, catastrophizing, e.g., expecting the worst, and polarizing, e.g., only seeing things as good or bad, black or white. Here's how you can defeat these negative thought patterns. Evaluate your thoughts. Observe your thoughts throughout the day. Consider the way the content of your thoughts make you feel. Put a positive spin on negative thoughts. For instance, if you find yourself thinking, "I'll never get my life together," change the thought to something like, "Things are really tough for me now, but, with time, things can improve." Spend time with positive people. When you are around negative people, your thoughts will quickly go south. Dedicate your time to people who make you feel good about yourself and life. 2. Practice self-compassion. When you go through something bad like a traumatic event, you may unconsciously bully yourself. You may judge yourself for not getting over it faster, or call yourself weak. Doing these things only serves to make your PTSD symptoms worse. Fortunately, research shows that learning to show yourself compassion can help you recover faster. Show self-compassion by engaging in self-care activities like treating yourself to a manicure or drinking a cup of tea. Be nice to yourself and validate your feelings as being common aspects of humanity, such as saying, "It's okay that you are sad." Many people feel sad at times. Avoid isolating yourself and call over a friend when you aren't feeling so great. Tell yourself that you are worth it, and that all is good. Treating yourself positively and having a positive self-mantra will help to reinforce a positive outcome. Develop a self-soothing mantra like, "This is a moment of suffering. Suffering is part of life. May I be kind to myself in this moment, and give myself what I need to heal." 3. See a professional. No matter how hard you work on your own, it may be difficult to overcome the trauma of PTSD and regulate your emotions alone. Consulting with an experienced mental health provider like a psychologist or therapist can help you develop more strategies for controlling your mood. Treatments shown to help people with PTSD include medications, psychotherapy, or a combination of the two. Medications proven to help with PTSD typically include antidepressants. These drugs can help you battle negative emotions and deal with the numbness or hopelessness that comes with this disorder. Talk to your doctor to see if antidepressant medications are right for you. Antidepressants that are used to treat PTSD include SSRIs or selective serotonin reuptake inhibitors. They help to increase the availability of serotonin at the synaptic cleft, thereby increasing a positive feeling throughout the mind and body. Psychotherapy, or talk therapy, may be done one-on-one or in a group setting. In therapy, you may become more informed about your PTSD symptoms, learn emotional regulation, and discover approaches to identifying your triggers and managing your symptoms. 2 forms of therapy shown to be effective with PTSD are exposure therapy and cognitive restructuring. Ask your mental health provider about these approaches to decide if they may be helpful in your treatment program.